Thanks everyone for coming tonight to another community conversation presented by ACCM. Tonight we'll bring you this panel discussion on HIV and STI testing in partnership with Jacques et Jacques, a joint project conducted in partnership with Direction Santé Publique of Quebec. We're pleased tonight to screen as well the film Moon Trail in the presence of its director. Before we get started with their panel, I just want to thank Kajibi for the use of their space, especially Pamela for all of her hard work. Department Santé Publique de Montréal, all of our panelists here tonight, the Moon Trail team, Jacques et Jacques, and everyone for coming. Thank you so much. So I'd like to introduce ACCM for people who aren't aware of us. I think probably everyone is, but for those who aren't, ACCM has a 28-year history of serving people living with HIV and hepatitis C on the island of Montreal. ACCM envisions a society free of stigma and are committed to building a community where people living with HIV and hepatitis C receive the support they need. So for those who are interested about our organization or testing or other resources, we have a table right at the door. That also has a guide to pretty much all of the testing clinics on the island with information about how to access them. So tonight, in the vision of continuing our series of community conversations, we are again holding a panel in a bar. So just be aware that there might be background noise, different things like that, and we'll try and manage that as best as possible. So I'd like to start tonight by introducing Eric Lefebvre. Eric has worked in the field of sexual health since the beginning of his nursing career in 2007. He started out with Ottawa Public Health, where he offered STI and HIV screening in various environments and sat on diverse committees and groups related to LGBT health. He's also helped coordinate the opening of a new service, Gay Zone, Zone Gay, an STI screening clinic for gay and bisexual men in Ottawa. So since 2009, he continued in this line of work at Clinique Médicale Quartier Latin in Montreal, and Eric now sits on the board of directors of Réseau, and as well is a Quebec representative for the Canadian Association of Nurses in HIV/AIDS Care since 2013. So thank you very much for being here, Eric, and you can take this next.
What did you want me to talk about?
Go for it. Talk about your work.
About my work. The guys asked me to talk about my work from a nursing perspective, and a bit of the challenges that I see. We're doing each turn right now?
Yes, we'll go through the panels.
Okay. So often what I see as challenges is people who don't really understand how to evaluate their risks, and so that's often a discussion that we need to have with patients. I mostly do testing with gay and bisexual men at the clinic. I try to talk about new advances like PrEP, and a lot of questions come up about HIV viral load and undetectable, and the risk in those situations. I make sure that people are always aware of PEP, the post-exposure treatment. A challenge in a semi-private clinic would be guys who don't have a health card or private insurance. And as a nurse, we also have some limits when we can do testing for people who have symptoms or not. This is less of a worry for me because I cannot easily call a doctor or knock on the doctor's door. But if somebody has a rash or just flu-like symptoms, we can't even do an HIV test. And the same thing for some treatments. Some of that is going to change by the end of the year because the nurses are going to be having a prescribing number, just like doctors, so we can prescribe treatment for gonorrhea and chlamydia. but this will only be like for guys who don't, for people who don't have symptoms. So the next step will be for people who do have symptoms. A typical interview would be just general, like when the last person got tested, if they ever got tested, and what's their sex life looked like since then. Alcohol and drug use. I don't really ask specific questions that always public health asks me to ask, like you know, number of partners and things like that. I try not to make it a questionnaire, so it's more flowing and less boring actually. Also, and then depending on what activities, sexual activities, patients have done and will do, like blood test, urine test, throat swab, anal swab, or vaginal swab. And we can also do a rapid HIV test with a finger prick. What else? Some challenges that I see also is like the results. So often people have to come back for results in certain clinics, or they have to do like a telephone tag kind of thing. I work by email, and I have guys sign the consent form, and so I send them an email the day of, and then they reply to me like in a week or two and ask me about the results. Because most of the time we do a rapid HIV test, so if I need to call them for syphilis or gonorrhea, chlamydia, that works over the phone. So guys really appreciate that, and ideally they would have access to their test results online if we could, but it's always a question of security. When someone has a positive result for HIV, sometimes, like most of the time when I've given a positive result, it's been a rapid result. I've worked a lot with the rapid test. So it's always important to make sure before doing the test that the person, like what they know, to evaluate what they know about HIV in general and transmission, and if like how they would react if they had a positive result, what kind of their support system looks like, and if ever they do get a positive result, it's about reassuring and talking about, you know, the lifespan, that it's not what it was 20 to 30 years ago for what some people know about HIV, the treatments that are getting more easy, and we're even seeing some studies that are looking at injections like every 2 or 3 months instead of taking pills every day. And then also partner notification. So if someone has been newly diagnosed, especially if they're in primary infection and the virus is very contagious, then we try to reach their partners in the last couple of months. We can do that anonymously and through public health also. Obviously, we evaluate if somebody has any like dark thoughts or suicidal risks. And then we also refer to community partners, like ACCM, of course, and Réseau and Maison Pécœur at the CLSC. And we have a social worker and a psychologist at the clinic. You guys had asked me to talk about the different types of tests, the HIV tests. At the clinic, we don't do an anonymous HIV test. That's mostly done in certain CLSCs and like at the SPOT project. So the anonymous means you don't have to show up with like any piece of ID when you can do your HIV test. There's a nominal test where you have an ID and you open a chart, but instead of using your name, it's a code that's used in the lab. Like, let's say if I knew a lot of people that worked in the lab and I didn't want them to know what my testing, then I can ask that kind of test, and it would be nominal, but it would be put into my chart when the results get in. And then the confidential testing is just the standard regular testing where it's your name and it goes to the lab and it comes back in your chart. For surveillance purposes, there's gonorrhea, chlamydia, and syphilis that are, I know the name in French, but it's the maladie à déclaration obligatoire. And so those go to public health from the laboratories. In Montreal, we don't really do any surveillance for gonorrhea and chlamydia. There's too many cases actually. So we do surveillance for syphilis. And so, like once a month or so, I get some results from a public health nurse, and I have to go through them to see, like if these were new cases of syphilis and maybe how people got them, and that helps us evaluate the programs. And at one point, we knew that there was a high percentage in young gay bisexual men, sorry, and so we had a kind of a different approach or different strategies to how to reach them and their partners. For HIV, it's not the same thing as the other infections. They are kind of given another code with the public health lab, and those are also like for surveillance. So we know if ever something pops up where there's a lot more transmission in a certain group, and what we can do to do more health prevention in those groups. As far as treatments go, all are covered for people who have a Quebec health card. And whether guys are HIV positive or negative, I think it's just as important to get tested. There can be long-term consequences for infections like syphilis if they're not treated early. Like if they're detected in the first year, you only need 1 shot of Bicillin in each butt cheek, and if not, after a year you need like 3 times. So that's a good reason to get tested more often. And I guess that's about it.
Well, thanks so much, Eric.
Okay.